All right, why don't we go ahead and get started? We may have a few more members come in, but I know everybody has set aside this time, and I appreciate that so much. I'm sorry, I'm trying to not hurt anybody up here, trying to pull my chair up. Good afternoon. It is so nice to see all of you as we come together to look at this 17 budget and discuss, I think, all of these very important measures. We've got some great speakers here today, so I look forward to that. Without further ado, we'll start with the Commissioner for the Department of Behavioral Health and Developmental Disabilities, Commissioner Frank Berry. Thank you.
Madam Chair, thank you very much, and members of our committee, I want to thank you for all of your support over the last several years. It has truly impacted a large number of individuals that desperately need our support, so thank you very much. And today is Rome Day, is my understanding, here at the Capitol, so this is a big day. We may lose you to go and eat some good food and stuff like that, but just hang in there with us.
I've already done that. They've just gotten on the bus, so I am all
Very good.
here.
You're set. All right. Very good. Before we get started, I certainly wanted to recognize several people that helped with our budget in a significant way. Jeff Miner's here, Mary Price, and Chris Hamilton, who helped put this together. But when we presented our budget to the governor, we had a very healthy discussion with the governor, Chris Riley, Ryan Teague, David Werner, and of course Teresa and Rick. And we had a really thorough discussion about what we're trying to accomplish as a department. And I think, as you can see up on our slide, easy access to high quality care, helping individuals lead a life of recovery and independence. And we deeply believe in that. We believe that people with behavioral health challenges, when they're given the support that they need, can live a life of recovery, meaning that they can hold jobs, meaning that they can be instrumental members of their community, they can be better husbands and wives, sons and daughters, but they need support. And we certainly recognize that without those additional supports, we struggle at times. And I think we have made some significant progress over the last several years in addressing that. I also want to recognize our team at the Department of Behavioral Health. It is a remarkable team of people that work tirelessly to both address crisis situations that come up, but also are changing a system. We've learned that a system that was based on a hospital infrastructure that was 150 years old, with what we're trying to accomplish today of serving people as close to home as possible, is not the best approach. And so they have redesigned the whole system. And that's been a remarkable piece of work that's been done. Judy Fitzgerald, our chief of staff, has been leading that work, and it's just been some of the most comprehensive reform that we have done. But I want to also be very, very clear, we are not where we want to be yet, and there are still struggles that people face every day of accessing services. We recognize that. We are far, far from perfect, but we are moving in that direction, and as long as we're all here, that's the goal that we have, is to get the system to be better. So I just wanted to take a minute to thank that. And certainly Roma from the House Budget Office has been instrumental in helping us, and the partnership that you have with our team is something that we greatly appreciate, and they talk about that on a regular basis, so thank you. And I would not be fair if I didn't mention Martha. Martha has been wonderful. I've known Martha for many years, and her support is just incredible, so thank you. We have a short PowerPoint presentation with some administrative functions that we'd like to talk about, and then certainly want to open it up for questions. We have some administrative changes that we're looking at, one of which will be across the board to all state agencies, and that's the 3% increase for state employees. And I think it's a great start to addressing some of the positions that we have in the Department of Behavioral Health. People who have worked for 20 and 30 years and for the last 8 may not have gotten a raise, and some of them are making $21,000, $22,000 a year. So we are greatly appreciative to the governor for doing the 3% increase for state employees. You can see that there are some adjustments to TeamWorks, the financial and HR system. That's again an across the board for all state agencies that we'll deal with. And the DOAS insurance premium adjustment. So I know that you're familiar with some of those. And then, of course, the FMAP rate adjustments. So those things are administrative issues that all state agencies face, just as we do. We don't really, to be quite honest with you, we don't really have a choice but to ask for those. But the real exciting part of this budget for me is what we're going to talk about next. And I'm very proud to present this budget. This was one that, for the first time after the settlement agreement dollars expired last year, this is the first budget that we really had a healthy discussion with the governor and his staff about what we're trying to accomplish. And so if you'll look on 15.2.1, which is an increase for 100 additional slots for the now waivers. Now remember, the settlement agreement put waiver money in each year. And for us to be able to continue to help people get off the waiting list who are in the community and get on those now waivers is something that we're really proud to be able to present to you. It does address the waiting list. Does it address it in the most meaningful way of the thousands and thousands that need it? We still have to continue to chip away at this, but an additional 100 slots, again, is something that each year, if we can continue to get more and more, I think we'll be in better and better shape. 15.2.7 on your document is the comp waiver provider rate increase. There has been a tremendous amount of discussion about this issue. Last year and the previous year, we began to work with the provider community and with members of the General Assembly on looking at what a rate increase would look like. I have directed Dan Howell, our Division of Intellectual and Developmental Disabilities Director, to come up with a comprehensive way to look at this. We provided a rate study through Burns and Associates, which is a federal requirement in order for us to do a comprehensive rate study. And I'm pleased to say that the governor's budget provides for the residential component a provider rate increase of to the amount of $11,900,000 over the next, and this is a rollout over the next 3 years. But we believe that in order for us to ensure that the quality of services that we are delivering continues to improve and increase, we have to be able to recruit and retain a higher quality provider than we've ever been able to do before. And this rate increase, we are confident, will begin to address that. We have heard from providers across the state, it has been a long, long time since they have had a significant rate increase, and this rate increase is one of the most comprehensive and meaningful rate increases that we've had in my 20 years in Georgia. It's a massive rate increase. The other one, 15.2.9, you'll see, for $2,843,000 is the Gracewood staffing. CMS required us to adjust the staffing patterns that we have out at our Gracewood campus in Augusta, 93 direct care positions, in order for us to be in federal compliance. What's fascinating about this is that just last week, CMS showed up unannounced for a site visit, and we were able to convey to them that this is part of our budget request. So the site visit went well. We had a very, very positive outcome with that visit, and we're excited about being able to certainly meet the compliance issues, but I also think to be able to continue to demonstrate high quality care to the individuals that we serve that are still in our state hospitals. We also have 15.4.4. We've talked about this for the last several years. We believe that when you send people into our state hospitals, it's very difficult for them to ever get out. And we've talked about this before, but Miss Brown was a great example of somebody who was admitted in 1941. And in 2015, she passed away after having lived all those years from 1941 until now. She was 98 years old. We believe that the best thing to do is keep people as close to home as possible, and so that they can access their community-based resources while they're in the Behavioral Health Crisis Service Center and then immediately upon discharge. So we have asked for funding for one Behavioral Health Crisis Center. We will continue to ask for those over the next several years because we have heard from, most importantly, from the individuals that we serve, that they really like to be able to be dropped off as close to home as possible. The sheriffs do not have to transport them far distances. We had a meeting with the Sheriff's Association 2 weeks ago, and these behavioral health crisis centers are now working. We need more of them, but they are working. So that's what that one BHCC is requesting. And then, as you'll know, and as you know, the juvenile code rewrite is the third leg of the stool of the criminal justice reform. Children who are waiting inappropriately in either an RYDC or a community jail, or just waiting even at home for a disposition based on waiting for an evaluation, really can impact their behavioral health needs and challenges. So we are asking for forensic evaluators to be able to complete the forensic evaluations for those individuals so that they're not having to wait inappropriately in the inappropriate place. And then finally, number 6, which is a hospital salary adjustment. You'll see that across multiple areas, so there's multiple numbers for that. We can get you those when we finish. For $8,895,000. Why is this so important? We had 100% turnover of our direct care staff from the time that they went through orientation until the time the end of the fiscal year occurred. 100% turnover for new employees out at our Gracewood campus. We are not competitive. We were not competitive with the Department of Juvenile Justice. We were not competitive with the Department of Corrections, and we were losing large numbers of staff to those agencies because they would go for a 3 to a 5 to an 8% raise just by switching jobs. And we believe that in our department, it's equal to the front line of those two departments with one additional challenge. The unpredictability of the individuals that we serve at times can cause even greater challenges. So this $8,800,000 is a way to make some of our entry-level individuals, some of whom are making $17,000 and $18,000 a year, up to a minimum of what the Department of Juvenile Justice and Corrections were making, which is right around $24,000. So it's really a critical aspect for us. When we did the slight adjustment to them last year, it was a great start, and morale, we saw that improve tremendously. But if we're going to continue to support the individuals that serve some of Georgia's most vulnerable youth, we have to do a better job of compensating them. So I very respectfully ask for those. And then the two other small adjustments are, there was a request, one-time funding last year for Georgia Options. We are removing that from the budget. And then we have an attached agency with us for a clinical evaluator, the SORB agency, and that's the Sexual Offender Review Board, and that's what the $89,551 is for. So I believe that we are making significant progress in addressing some of the challenges that we're faced with as a state. I think as we move to more community-based resources and community-based care, our hospital footprint will continue to stay with the remaining hospitals that we have. However, the goal will ultimately be that those hospitals will be used for forensic individuals and for people with long-term chronic behavioral health challenges, adults with chronic behavioral health challenges. So as we continue this path moving forward, our hospitals, though, are going to be with us for quite some time. And there will be some needs in our hospitals. Some of our hospitals are 60, 70, 80 years old. We'll continue to have needs in those hospitals that we'll keep you informed of. I think that as we continue to partner with the advocate community and with the provider community, more and more people will want services. And so ultimately, we're going to have to address our core infrastructure. Some of our community service boards, along with our private providers, have been funded at the same level for a number of years, and we ultimately are going to have to address that. And then finally, the last part that I'll share before we open it up for questions is substance abuse. We have really, over the last 10 years, when the budgets were in despair, substance abuse was one of the hardest hits, and it's time that we started to look at substance abuse again. When I had the discussion with the governor, we spoke about the number of individuals that are coming out of the correction system now with part of his reentry and criminal justice reform. And over the next several years, more and more. So as those individuals continue to transition out of the correctional system and into community care, we will need to address this in the future. So I'm looking forward to having that discussion over the next couple of years. So that concludes our formal budget request, and I certainly want to open it up for any questions that anybody may have. And again, Madam Chair, thank you for your ongoing support and leadership, and members of our committee for your ongoing support and leadership.
Well, thank you as well for yours. You are doing a great job, and it is good to be on the other side of that settlement agreement and
Thank you.
Be looking ahead.
Thank you.
Are there any questions from the committee members? Let's see. Representative Oliver.
To 1529, the 93 additional direct care staff.
Yes.
How many patients are still at Gracewood and are subject to a required removal from the hospital?
So currently there are right around, I can give you the exact number. Let's see. There are currently, let me see, I'm right here. East Central, right here. One, ICFMR is 173 individuals. And then on the SNF unit, there are 42 for a total census of 215.
And how many of those patients are subject to the settlement agreement to be removed?
So we are currently in discussions with the Department of Justice. We go back to court on March 28th. We believe that somewhere right around the 173 of the ICFMR, and we are discussing the status of the skilled nursing facility, the 42. But we certainly know that the 173 are subject to that.
So comes to my question, obvious question. You're going to be putting 93 new staff there, which you're required to do, but I assume when the 173 patients are removed and possibly some disposition of the 52 nursing homes, that those 93 staff people will only be there temporarily. Am I right or wrong?
No, ma'am, you are correct. Then the goal, now, there's a nuance there, and it's the pace that we're able to transition individuals into their own homes. That pace has slowed over the last several years.
And that's what Judge Pennell is talking to you about in March?
That is correct.
And he's
Yes, ma'am.
upset with us, fairly, unfairly, he's upset with us.
He's not upset with us in regards to, he's upset with us in regards to the pace. We had worked cooperatively with the members of the amici, the group that brought the lawsuit to the state of Georgia, along with the Department of Justice to suspend transitions for a period of time. We made the decision to make certain that the infrastructure that we had in place to serve these individuals in the community, when you go from serving everybody in a state-run hospital setting to a privately run 4-bedroom or less group home, the complexities with that were something that needed more time to develop, the infrastructure rather. And so what he's upset with us about is that, no, we did not meet the numerical target at this point, but he's also upset with us about some of the quality in the community. And we are addressing those issues. We have significant plans that have been underway for quite some time that we have not we have not gone to court yet to convey, and we will. And I think when the judge hears what we have done, I think we'll hopefully see a different side of the judge.
May I have one more question, Madam Chair?
Yes, certainly.
I think I asked this before, and I'm still a little bit confused. I understand that from federal mandates, our now comp and other waivers are going to be redesigned and re-identified and re-implemented. Can you tell me what the timetable on that is? Is it in FY17 that some of that's going to happen?
A significant portion of that will happen in 17. We have waiver requests that will be going in, that have gone in, so that will address a significant amount of that, and the infrastructure needed to provide the support for that new waiver rewrite has been developed and is continuing to evolve as we speak. So it should be in 17, yes.
Do you have a guess as to whether our waiting list will be redefined as larger or smaller after we redo this categorization of waivers?
I'll get an answer for you on that, on whether it will be bigger or smaller.
Okay.
But it'll be redefined. I do know that, but I'll get an answer for you on larger or smaller.
But it's a big deal,
It's a huge deal.
and it should, I would assume, a huge deal budget-wise.
Yes.
Forgive me, one more. Georgia options, tell me a little bit more about that in terms of the withdrawal of that money
So-
and what impact that might have.
So last year, there was a request for one-time funding, and the one-time funding was put in last year, within this year, the goal being that it would be self-sustaining. And so because it was one-time funding is when you all put it in last year, this year it was removed.
Thank you. Chairman Benton.
Thank you, Madam Chair. On 15.2.4, the increased funds for 100 additional slots for the now waiver. What is the drawdown on that?
The federal drawdown will be, it'll be 68.89? 67.89%.
Okay. In dollars, please.
In dollars. You have a dollar figure for that, Chris? $3.8 million.
Okay. Have y'all, and I'm sure you have, but I'm asking the question because I don't know, and have y'all looked at any other creative ways to get drawdowns on federal funds on these waivers?
So there's partnerships that we explore with other agencies. For instance, Greg Smead is here, and it's been a phenomenal partnership of maximizing federal dollars when we partner with them. On this one in particular, we've not really explored, I mean, we're constantly exploring ways to draw down more federal funds, but on the now and comp waivers, they're pretty much set in stone. So there's not a lot of flexibility with that.
All right. On 15.2.7, provide 6 months of funding to reflect a provider rate increase. What percentage increase is that?
You have a percentage on that one? What is the percentage on the provider rate increase?
It's a little challenging, but the generalization would be 50%.
50%?
Level. So we currently have one level for
Okay.
residential services
And
that
what-
will be spread across 4 levels.
Okay, and what did you say the percentage was?
The level 4, which is the highest
Uh-huh.
category, would be approximately 58%.
I'm sorry,
Increase, 58%.
58%, okay.
For the more complex individual
All right.
tests.
On 15.4.4, one behavioral health crisis center, where's that going to be?
We are looking at the data now to determine the best location. We have 3 potential locations, and we're
Okay.
looking at what makes the most sense at this
Is
point.
that something y'all will build or something you'll rent?
We will actually contract with a private provider, either a CSB or a private provider,
Okay.
to deliver that service for us.
All right, thank you, Madam Chair.
Thank you, sir.
Representative Howard.
Thank you, thank you, Madam Chair. Okay, Commissioner,
Good to see you.
My question, I'll piggyback on the Gracewood conversation. Living in Augusta, we get a chance to hear constituents on both sides, and I understand the Department of Justice piece. But when we really look at it, there are some patients that are across the state. But I know of cases right there in Augusta, and I'm sure some other members may have cases too in their respective counties or whatever, where you have patients that are profoundly severe, and those parents are caregivers of the one that are looking after or seeing after these patients, have experienced the institutional settings, and now the fear of have to put a patient that requires so much care into the community. There's some fear there. Those slots, the 73, I think, is what the number I think I heard. Is that what those slots will be used for, or to maintain those folk at an institutional setting, or what would those slots be here?
So it was 173 on the intermediate care facility at Gracewood, and then a total of 42 individuals who are at the skilled nursing facility at Gracewood.
Right.
And so those slots, we have now in comprehensive waivers that are currently available. So for those individuals that require the most intense level of care from a medically fragile standpoint, they more than likely would transition out of Gracewood on a comprehensive waiver. For the now waivers that we're requesting, those are primarily for individuals who are already in the community who are in need of additional support. And they refer to that from individuals that live in the community primarily as being self-directed. They like to pick and choose what services their loved ones get. And so the now waivers that we are requesting are more for individuals that are in the community currently, whereas we have the comprehensive waivers that have been required through the settlement agreement to serve some of the individuals that will be transitioning out of the Gracewood campus.
So the ones that are critically...
Yes. For those that can be moved to the community, they will go out on a comprehensive waiver. And we have those waivers available.
So the ones that are critical, severe,
yes,
they will also be moved on a comprehensive, or will they stay?
So those that can be moved out of Gracewood who are severe, medically fragile, will move out onto a comprehensive waiver. That we already have.
Okay. Right. Okay. Follow up on another subject, if it's okay.
Yes.
On the, you came to, we did a conference in Augusta with your presence there, and I appreciate you coming down. And this is, I think, a statewide issue too. Adolescent mental illness and drug abuse. And I apologize for running a little late. Is there any additional funding going in to your request for that, into that area?
The one area in the discussion that we had at the forum in Augusta had to do partly on, if you remember, juvenile forensics.
Right.
And there was the court administrator who raised the issue that there were large numbers of individuals that they were seeing who needed either a psychological evaluation done. So the piece that our department has asked for is the forensic evaluators, which is 1573, to help alleviate some of those young people that are waiting for a disposition or an evaluation in order to move on through the juvenile justice system, which was a big topic that night. So that's the one piece that our budget does address. There may be some other agencies such as DFACS and Department of Community Health that are looking at children's work as well, but this is the one piece that our budget does address.
All right, thank you.
Chairman Abs. Is your button on? No. Are there any other questions? Oops. Oh, how do I get there?
Thank you. On 1573, provide funds to implement the juvenile code rewrite, do we have to hire somebody to do that, or do we not have anybody?
We will hire people to do that work, and it's forensic psychologists that will do that work.
In other words, we don't have anybody qualified to do that in the...
We need more capacity. So it's a capacity issue. There's still large numbers of individuals that are waiting for that evaluation to occur, and in order for them to move through the juvenile justice system, they have to have that evaluation done. Mm-hmm. And it's a caseload issue.
Okay, thank you.
Thank you. Are there any other questions? Well, thank you, Commissioner.
Thank you very much.
Thank you.
And again, thank you to the committee for all of your support. Thank you. Certainly want to remind everybody that if they have any questions, of course, Andrew is back from being out on surgery, and Stuart Wilkinson has done a remarkable job, and they'll both be here on a regular basis. So certainly if you need me, a great way to get in touch with me is through them if you can't get me directly. Thank you.
Thank you, and thank you for the work that you and your entire department are doing.
Thank you.
Sincerely appreciate it. And next, we will hear from Commissioner Robin Crittenden with Department of Human Services. Whenever you are ready.
Okay, thank you. Good afternoon, Chairman Dempsey and members of the committee. It's a pleasure to be here today to present the FY 2017 budget for the Department of Human Services. I'm joined here today. Unfortunately, Director Cagle was unable to be with us today to present the DFACS portion of the budget. And excuse me, I'm at the tail end of this cold. But Cliff O'Connor is here, and he'll be discussing the DFACS portion. I'm also joined by other members of my team, Geralda Hines, who's the Deputy Commissioner and CFO, as well as our Budget Director, Demetrius Taylor, and members of our legislative and communications team, Ashley Fielding, and I think, oh, Jackie's over here, Jackie Tate. And so I'd like to just go ahead, and I will be following the tracking document in reviewing the changes for you. If you could turn to section 28, which is the Department of Human Services. The first section is 28.8, which is Departmental Administration. And these represent the standard adjustments to pay, insurance, and merit system that are in all of the budgets this year. You'll see them reflected in the different program budgets throughout our section of the budget. The next section that I'd like to turn your attention to is elder abuse investigations and prevention. I want to thank you for your support these last 2 years for a total of 22 APS workers. And this is the third component in what was originally supposed to be a total of 33 APS workers. And so you'll see, excuse me, that this reflects an additional $760,000 for 11 additional adult protective services caseworkers in line 28.9.4. In addition, in line 28.9.5, it provides additional funds to cover adult protective services caseworkers that had been added in FY15 and FY16. This will cover equipment as well as additional funds for those caseworkers. And that's a total of $266,497. The last component of the Elder Abuse Investigations and Prevention section is in line 28.9.6. And this is to increase funds to cover the loss of federal revenues and operational costs. These funds were lost during sequestration and never replaced in the budget. This is a total of $1.576,457 million. The next section that I'd like to discuss is 28.10, which is the Elder Community Living Services. And again, this has the standard adjustments to pay insurance in the merit system, so I'll just go right down to 28.10.5. And this line item transfers the Community Care Services Program, or CCSP, to DCH, to the Medicaid Aged, Blind, and Disabled Program. And that's a total of just over $67 million. The next line is 28.10.6, and this is an increase in funds for 1,000 non-Medicaid home community-based services slots. And I'd like to, in discussing this, I'd like to acknowledge Kathy Floyd and the Council on Aging for their work in identifying the amounts here. This is just over a $2 million increase for an additional 1,000 slots. And so that concludes the changes to the DHS budget. I'm going to ask if Cliff O'Connor would come forward and review with you the changes to the DFACS budget, and then we can take questions at the end. Thank you.
Good afternoon. I was going to cover the 5 program budgets where there were no, and I was going to skip over the statewide adjustments since I think you're all familiar with them. So the 5 program budgets, I'm going to start with Child Welfare Services. And if you go to 28.6.5, this is provide funds for 175 additional child protective caseworkers. This is the 3rd year of the plan to add 175 case managers over 3 years. We're very appreciative of the support we've gotten from the legislature and the governor for this. The dollar cost in state funds is $7,367,000. 28.6.6 is transferring TANF funds from the out-of-home care program to reflect projected expenditures. It's a transfer of $49.3 million. You see a similar transaction in the out-of-home care budget where the funds transfer from. The next item is 28.6.7, which provides funds for 10 additional kinship navigators. That's $584,049. Right now, we have 1 kinship navigator for each of the 15 regions. This would provide, obviously, a significant increase in that effort. And 28.6.8 reduces funds to align budget with the Temporary Assistance for Needy Families Block Grant in the amount of negative $36,579,000. This ties us out to the TANF block grant total amount of $330.7 million across all program budgets. The next program budget I was going to talk about was 28.13, which was Federal Eligibility Benefit Services. The first 3 items are statewide adjustments. 28.13.4 increases funds to hire 180 additional eligibility caseworkers for operational costs to avoid further federal penalties and sanctions. The amount is $5,380,124 in state funds. We've obviously been struggling with very high caseloads and having some issues with the federal courts and our federal partners, so we think this will be a significant help in managing those caseloads. The next program budget to discuss is 28.15, which is out-of-home care. The first item is 28.15.1, transferring TANF to the Child Welfare Services Program to reflect projected expenditures, a negative $49.3 million. You saw that in the Child Welfare Services budget also. 28.15.2 is increasing funds for growth and out-of-home care utilization. The dollar amount in state funds is $51,482,000. Just as a reminder, this is similar to what you had in the state fiscal year 16 amended budget. So the budget assumes a 14.7% increase in spending from state fiscal year 85 to state fiscal year 15 to state fiscal year 16, and then flat budget for state fiscal year 17. So there's a possibility we might be a little bit low here, but I think we in OPB were hoping we could get into next year's process and see whether that growth would stop or not. The next item is 28.15.3, replace prior year TANF, temporary assistance for needy families. With state funds, the amount is $49,339,792. And those are all, the next item is a statewide adjustment, 28.15.4, so I won't really discuss that. The next substantive change is under 28.19, support for needy families, work assistance. 28.19.1 is increased funds to provide the state match to implement the Supplemental Nutrition Assistance Program, SNAP Employment and Training Program grant. It's $100,000 in state dollars. We were recently awarded $15 million for employment and training efforts with SNAP clients. This helps us meet the state match requirements on transportation costs for those participating in that program. Those are all the substantive changes, and we'd be glad to answer any questions you may have.
Are there any questions from the committee? I am not seeing any. Y'all will have to send word to Director Cagle that you did a great job.
Thank you very much.
Thank you so much. Appreciate the work that y'all are doing for Georgia's children and families and elderly particularly. Okay, next it's time to hear from our veterans. Commissioner Mike Roby, please.
Thank you, Madam Chairman, committee members. Our discussion this afternoon is based on the House Budget and Research Office tracking document for House Bill 751, found at Section 48 on pages 96 and 97. The excerpt of those pages is found in the handout folder provided to you. We want to thank the members of the subcommittee for giving us the opportunity to discuss our department's FY 2017 budget. With me today is Assistant Commissioner for Administration, Health and Memorials, Mr. Dan Holtz, to my right, and our Assistant Commissioner for Field Operations and Appeals, Mr. George Canavaggio. We're also honored, ma'am, to have with us today the State Commander for the Georgia Department of American Legion, Mr. Tom Mash. Tom? Overall, we are pleased with the funding provided for the Department of Veterans Service in our Governor's recommended budget for fiscal year 2017. At this point, we will review the several changes for our budget by program and discuss a concern we have about the proposed funding for the next fiscal year. In our administrative program at line 48.1, there are several changes reflected. Lines 48.1 through 48.1.5 totaling $28,400 reflect additional funding to support merit-based pay adjustments, merit system assessments, agency premiums for DOAS, and self-insurance programs, team works building, and an adjustment for payroll shared services. In our budget request for the amended fiscal year 16 and FY 17 budgets, we asked for an additional $25,000 for each year to support the certificates and pin ceremonies around the state related to the commemoration of the 50th anniversary of the Vietnam War. These funds were recommended in the governor's budget for amended FY 16, and this subcommittee approved this additional funding, for which we thank you very much. However, these additional funds were not included in the recommended budget for FY 2017, even though we have said all along the presentation of the Governor's Certificate of Honors and the U.S. Department of Defense lapel pins will take at least 4 years to get these out to as many of the Georgia's 234,000 Vietnam War veterans as possible. To date, over 9,400 certificates and 6,800 Department of Defense lapel pins have been presented at over 112 ceremonies across the state in which our department has participated directly or indirectly with other DoD commemorative partners. We want to again thank the members of the Georgia House of Representatives who have so graciously given of their time to support these ceremonies in and near their districts across the state. When we are contacted by local veteran service organizations and other groups about hosting ceremonies, we always encourage them to contact their local members of the General Assembly and invite them to participate in the ceremonies. With all that in mind, we request the subcommittee add $25,000 in the administrative program to continue to support this ongoing effort during FY 2017. In our Georgia Veterans Memorial Cemetery program at line 48.2, lines 48.2.1 through 48.2.3, an additional $9,451 in state funding has been recommended for the support of our merit-based pay adjustments, merit system assessments, and DOAS self-insurance programs. At line 48.2.4 in the total funds column, there is an addition of $750,000 in federal and other funds from the Veterans Benefits Program related to projected expenditures associated with construction projects for the 2 state veteran cemeteries at Glenville and Milledgeville. This is a realignment of these funds to better reflect where they will be spent in support of state veteran cemetery construction and renovation projects. In our Georgia War Veterans Nursing Homes program at line 48.3, there are changes reflected that total an increase in state funds in the amount of $300,630 and in total funds in the amount of $902,057. Line 48.3.1 provides funds in the amount of $392,100 for merit-based pay adjustments and employment, recruitment, and retention initiatives related to the state's war veterans homes in Augusta, which is operated for the department by the Augusta University. Line 48.32 provides funds in the amount of $2,497, reflecting an adjustment to merit system assessments for the Augusta Veterans Home. Line 48.3.3 provides for a transfer of state funds from this program in the amount of $93,967 to the Veterans Benefit Program to support the operation of a new 2-person Veterans Field Service office in Decatur. In that same line under the total funds column, a reduction of $242,540 is recommended, which reflects the projected impact the reduction of the $93,967 state funds will have on federal and other funds coming into this program. The difference is $148,573. We want to note at this point the census at both the Augusta and Milledgeville homes has started to increase during the fiscal year 2016, especially in the area of service-connected disability veteran patients, for whom the federal government pays 100% of the cost of care. So in actuality, the projected reduction in these funds may not occur because we are admitting more service-connected disabled veterans to these homes. At line 48.3.4, there is an addition of $750,000 in federal funds and other funds from the Veterans Benefits Program related to projected expenditures associated with construction projects for the 2 state war veterans homes in Augusta and Milledgeville. Like with the cemetery program adjustment, this is a realignment of these federal and other funds to better reflect where they may be spent in support of the state war veterans home construction and renovation projects. Lastly, in our veterans benefits programs at line 48.4 and lines 48.4.1 through 48.4.4, there is an increase in state funds totaling $185,450 and a reduction of $1,314,550 in total funds. At lines 48.4.1, there's an increase in funds in the amount of $72,159 to support merit-based pay adjustments. At line 48.42, there's an increase of $1,337 to support adjustments to merit system assessments. At line 48.4.3, there's an increase of $17,987 to support DOAS self-insurance programs. At line 48.4.4, there's an increase of $93,967 to support the establishment of 2 additional Veterans Field Service Officer positions for our Decatur field office. At lines 48.4.5 and 48.4.6, a total of $1,500,000 in total funds is being reduced by transfer of $750,000 to the cemetery program, and a like amount being transferred to the War Veterans Nursing Homes program to support construction and renovation projects occurring within these 2 programs. At this time, we would happy to take any questions you may have about our department's funding and operation.
Go ahead. Representative Oliver.
Thank you. I'm a little confused about the transfer of state money, federal money for state money for construction projects. Have you previously budgeted state money for these construction projects in the nursing home and the cemetery that you are now paying for with federal money? That's one possible explanation of what you just told me. Am I right or wrong?
Okay. No, ma'am. I'm going to let Assistant Commissioner Dan Holtz assist with that.
Or is this new federal money and you're not replacing any state money?
We're not replacing any state money with this. This is, historically, we have had a line item in the Veterans Benefits Program where projected federal funds were placed primarily for an accounting methodology, so that when we get federal funds in from the VA or state funds from general obligation bonds that we use in some of our projects, that's where those funds have been accounted for. OPB came to us last year and said, you know, it really doesn't make a lot of sense to have those funds located in veterans benefits because they apply to the homes or they apply to the cemeteries. And so they asked if we had a problem with relocating those federal and other funds line items into the cemeteries program and into the nursing homes program, which is what is going on here. So they're strictly federal funds and or state bond funds if we have any. The way the thing works is if we don't have a project that's ongoing, we zero those funds out.
What projects do you have right now?
Right now we have 2 projects that are going on in the cemeteries program. The first one is a realignment of the headstones down at our cemetery in Glenville, which is a maintenance operational program that the VA has funded. And we are working the Phase 3 expansion project at the cemetery in Milledgeville. So those are the 2 that are ongoing at the present time.
Are there ongoing construction projects at the Milledgeville nursing home?
Not at the present time.
And
we have a couple that we're finishing up, but there's minimal dollars left on those. So we don't have any new ones coming at this point in time in the budget.
Is there any current bond money that you're spending on any construction project?
Not at the moment.
I asked at the supplemental budget for specific accounting on your population in your nursing homes.
Yes.
If that's come to me, I haven't seen it yet in my
It was
office.
provided to Roma, and she's nodding her head that she passed it out, so.
Okay. So you're saying your census is up, or you're saying your census is down, or you're saying
Census is up.
How about how much? On
an average from 2014 to 2015 at the state veterans homes, we've been averaging about 374 total patients. Back in 2014, that's now up to 392 at both homes.
And do you have a waiting list today?
We do, primarily on the regular veteran side of the house. We don't have any waiting list on the service-connected disabled side, because we're able to get those in right away because they're 100% funded by the VA.
Okay. Thank you.
Are there any other questions from the committee? Chairman Benton.
Thank you, Madam Chair. What is the total number of cemeteries that y'all look after?
Two. We have one that's located in Glenville, Georgia, that was opened back in 2007, and the original one that we have is in Milledgeville that was opened up in 2001.
Do you still have people being buried in those?
Both of them, yes, sir. We've
All right.
got plenty of space in both of them.
Okay. Could you tell me who looks after the Confederate cemeteries?
I cannot.
Okay.
We have nothing to do with that, and I'm not sure who exactly is handling that.
Okay.
Any other questions? I don't see any, so thank you very much. Thank you for being with us today and for bringing this information.
Thank you, ma'am, and thank you for all your support and the committee members.
Okay, so we have one more very important group to hear from, Georgia Vocational Rehab Agency, Director Schmid.
Just give us 30 seconds to bring the slides up, and I think we
Oh,
also
you
gave
take
each
your
of you
time.
a handout.
Does the committee all have this? Great.
Good afternoon, Madam Chair, members of the committee. It's always good to come before this committee, and I always appreciate the support you've given what we're trying to do with our mission, and I always like to use the opportunity to not only give you numbers, and we'll certainly go through the budget changes recommended for projected 17, but also to give maybe a little color commentary about our agency. And if you recall, when I presented on the amended 16, I gave kind of a snapshot of where we were 3 years ago, where we were today. I wanted to highlight a couple things. So if you don't mind, if you turn to page 2 there. And I just wanted to go over some highlights of our agency. And one of these is we're going to talk a little bit about with the 17 budget, but as you all remember, we did transfer the 2 hospitals at Roosevelt Warm Springs to Georgia Regents University under the Board of Regents, and that included the ownership, the license, all the staff associated with the 2 hospitals, and the property that the hospitals sit on, and that took place July 1, 2014. I mentioned last time that we've had all of our priority categories in our state VR program open with no waiting list, and I just also wanted to bring to your attention between state fiscal 14 and state fiscal 16, we've had a 48% increase in referrals, and more importantly, we've had a 98% increase in people being closed with successful competitive employment over the same 2-year period. I will tell you as an aside to that, as we've looked at VR data over the past several decades, about the most they've ever been served in our state is about 40,000. The charge that I've given our agency, and we've got great staff, is to go from serving 40,000 to serving 100,000, and from going from placing 5,000 people in competitive jobs to placing 50,000. So we're really trying to transform our agency for the future in our state, because we have so many citizens with disabilities who really could use competitive employment as a vehicle to their independence. As you heard Commissioner Berry mention in his presentation, we've had a great partnership with DBHDD. We have 2 MOUs that Commissioner Berry and I executed. One is on the behavioral health side, one is on the developmentally disabled side. And both of those, they actually transferred some of their state funds. We matched their state funds against our federal grant 4-to-1. So in the case of the behavioral health side, I think they gave us about $285,000 of their state money for supported employment, We matched that 4-to-1. That brought down almost an additional $1 million of federal money. This year alone, we've served 500 individuals with severe and persistent mental illness and moved them out of day services into supported employment in the community. And on the developmentally disabled side, they've given us about $518,000 in their state money for this fiscal year that we have matched again 4-to-1. That's about another $2 million. And the goal there is to increase our capacity to serve those individuals that have the most significant developmental disabilities and move them into either supported or customized employment. And so that whole braided funding concept, I think, is a really worthwhile concept that takes the best of state agencies. It doesn't require any additional money. We are a partner with Workforce Development through Economic Development on a federal disability employment initiative that's targeting Northwest Georgia as well as the Augusta region, again targeting individuals and youth with disabilities for supported and customized employment. I'm real excited about number 5 there. We're one of 4 states that received a federal career pathways grant, and it's really about increasing access to career pathways for youth with disabilities, whether they're in school or out of school, and certainly students with disabilities, and even as young as middle school. And you can see I listed some of our partners there: Department of Education, Georgia State, a group called the Burton Blatt Institute, and we actually got our match money, private funding, through a group out of New York City called the Poses Family Foundation. We have been very positive about a relationship with our post-secondary inclusion programs in the state. We now have a relationship with Kennesaw State, Columbus State, East Central Georgia. We hope to have one signed soon with Georgia Tech, and certainly the new program at UGA. And then finally, some of the highlights is because employers are really the other half of the equation that is so important, because they have the jobs, we've created a business division within our agency to really focus all of our engagement with employers in a positive way. If you turn to the next page, I also thought it might be relevant to just give some highlights on the new federal law that affects a lot of our state, actually, and that's the Workforce Innovation and Opportunity Act, or as some people call it, WIOA, W-I-O-A. And as you probably all know, in our state, as with other states, there are 4 core programs. Our partners: the Department of Workforce Development, which is under Economic Development in our state, the Department of Labor, Adult and Technical Education in our agency through Vocational Rehabilitation. Those 4 programs together will submit a unified state plan. Our current unified plan is in draft form. It will be submitted to the U.S. Department of Education and U.S. Department of Labor through the Governor's Office next month, March of 2016. That plan has already been out for public comment. We've received public comment, and that public comment is being incorporated. And then the last 2 points are really relevant to our agency, but they're important points to make. On the VR side, part of the new law includes some changes to the Rehabilitation Act of 1973. And one of the things the new law, and I view these as opportunities, one of the things the new law does is it allows us to serve youth with disabilities now down as young as 14, which really means that we can begin to go in really at the middle school level to 8th grade. Not that you want a 14-year-old to go to work, but how do we engage a 14-year-old in a meaningful way so that they see that there is a light at the end of their educational tunnel, whether it's to go on to college, and for those who can't go on to college because they academically can't do that, at least a career pathway for them. The other part of the law is the students with disabilities, and the federal law mandates that the VR program in our state must reserve or spend 15% of its federal grant on high school students between the ages of 16 to 22 in what they are calling pre-employment transition services. And again, that's where we're really working with the Department of Education, and our goal is to try to get into all 180 plus school districts in our state, 380 high schools in our state, and really try to intervene in a meaningful way as early as possible and engage those students, whether they have a post-secondary path, whether it's a technical college or a 4-year university, and more importantly, for those students that will not be able, again, to go on to post-secondary, how do we engage them so that they actually have a career at the end of their secondary experience? The law also mandates a formal employer engagement. And then the last one, item 4 there, is one that's really kind of important. And this is section 511 of the law. And it really says that any organization that has what is called a 14C certificate issued through the Wage and Hour Division of the U.S. Department of Labor. And this could impact our shelter workshops in our state, but the federal law mandates that those organizations that are paying subminimum wage now have to pay minimum wage to anybody that is the age of 24 or younger. And again, so I think the role that we can play as an agency is for those interested organizations who want to change and move towards more of a community-based service, how do we begin to assist them and help them transform? In the past, what would sometimes happen is a sheltered workshop would ask VR on a particular individual for a letter documenting that that particular individual cannot work, and therefore that would allow them to pay subminimum wage. When in fact, we have a philosophy and a belief in our agency that everybody can work. Given the right amount of support, everybody should be able to work. The only reason that they shouldn't work is if they choose not to work. But that's a very significant part of the new law that we think we can contribute to those organizations as they transform a little bit. So those are just some updates. I'm going to shift to the budget, and I'll be certainly happy to answer any questions about any of this when we're finished. I tried to do it all on one page, but it does come from the tracking sheets on pages 53 and 54, and I did list the tracking numbers, although when I was sitting back there, I noticed I must have dyslexia because I transposed the first number. But just to familiarize with what you're looking at, we've got our programs listed, and they're all in the 2800s because we are administratively attached to DHS. And then the first column is our current FY16 budget, all funds, and then within FY16, what part of that budget is state funds for that particular program, and then the proposed change in 17, the total for 17 in state, and the total for 17 all funds. Most of these you've already heard is across the board adjustments that are being made are recommended for all state agencies. So 28.2, 0.22.1, 0.2, and 0.3 are the merit-based pay adjustments. And instead of $3,093, it's really $3,903. So I apologize for that. The totals are accurate, though. And then the adjustment in merit system assessments and the self-insured premium adjustment. If there's parentheses or if it's in red, that's a money that's being taken away. So in the business enterprise program, the net impact there is $3,859. Then we move on to agency administration. The first ones are pretty much the same: merit-based pay adjustments, merit system assessments, the self-insurance. But then 28.23.4, that's actually transferring of $34,971 out of agency departmental administration and into the VR program. And that money comes from savings that we have obtained on our MOU with Department of Labor, who provides our IT support. So that's actually savings and state money that we're just moving from our agency admin into the VR program. And then the next one, 28.23.5, is actually transferring 12 positions that we've had in agency admin, and I'll tell you what those positions are, into the VR program. And those positions have been, one of the things we started early on was a constituent services department. We have a manager. We have 4 constituent advocates. All of them are alumni of the VR program. They all have a disability. And so we've really increased our informational calls, and the goal was to help consumers resolve any problems they had with our VR program or the agency at large. 99.9% of all the calls we've gotten have been about the VR program, so we felt it was more appropriate to move them into VR. We also have a disability liaison who works with all advocacy groups in the community, and then we have a small grant that we share with Shepherd, and that's benefits navigation, and so those are the individuals that are actually being moved into the VR program. So you'll see a transfer out of that $158,221, and then you'll see that reversed and put into the VR program. The disability adjudication services, as you know, is 100% federally funded, no state funds. Georgia Industries for the Blind, no state or federal funds. And then we get to the Roosevelt Warm Springs Medical Hospitals. So as I mentioned earlier, we transferred the 2 hospitals at Warm Springs to Georgia Regents University on July 1, 2014, and part of that transfer was that they would have a backstop or a safety net until they could get their profitability up to at least break even. And so for the past several years, the first 2 years, that amount has been $2,069,043. Of that, 1.6 million was money that had already been in the Warm Springs budget, and then to that was added the 469,043. FY17 is the third and final year of that backstop, if you will. So this is to move that 469,043 out of the backstop for the hospitals at Warm Springs. I'm not sure where it's going, but it is taken out of that hospital. And the way we actually do that is we pay them every month 1/12 of that amount. Again, I'd like to just make a comment there that at the end of 17, so beginning for state fiscal 18, we would like that remaining 1.6 million to come back to GVR so we can match that against our VR grant where it started. And just to comment on the hospitals, my opinion is they're doing very well. They've been growing at a good pace, and I think it's a great relationship. And then finally, we get to the VR program. And as you can see there again, the first several ones, merit-based pay adjustments, merit system assessment adjustment, self-insurance premium adjustment, and teamwork billings adjustment. And then I actually, again, my dyslexia came out. I reversed the numbers. So 27.5 is really that transfer of those contractual savings, the 34,000 coming back from the agency admin into VR, and then 27.6 instead of 27.5 is the transferring of those 12 positions from agency admin coming back into the VR program. So the net difference of all of these numbers and projected or recommended changes is a reduction of our agency budget of state funds of $178,558. And then just a couple more pages, if you bear with me, and then I'll be happy to answer any questions. So last time when I presented to the on the amended 16 to the Joint Committee, one of the questions was, where are you on the federal grants? So the first slide you got there on page 5 shows where we were in state fiscal 15. So what you can see there is the dark blue section is the part of our federal grant, which, as it says on the bottom, is roughly $100 million for our state, is the unmatched portion. And so in state fiscal 15, we had about $31.4 million of unmatched federal money, which means that it gets reallotted to other states for them to use. And now if you just turn the page, I'll show you the difference in projected 17. So what you can see is we've been able to narrow the gap. So our projected unmatched amount of that federal grant is now down to $15.1 million. And a lot of that is due to a variety of things. You know, trying to sit on vacancies and not fill staff positions. It's partnerships with DBHDD. It's the great work that our provider community have done. It's really trying to maximize and leverage our resources to the best of our ability without sacrificing services to anybody we serve. So I'm very pleased that we're moving in the right direction. To fully earn that $15 million, we'd probably need about another $3 million. But you can see we're closing the gap, and I think we're moving in the right direction. So I appreciate the opportunity to give you a lot of information, and I'll be happy to answer any questions that any of you may have.
Representative Oliver.
I lost you a little bit just at the end. I'm trying to figure out what page is you're closing the gap numbers.
It's really the final page. It should be page 6 on your slides. And what it's the dark blue quadrant of that pie graph.
Okay.
It says unmatched grant. It's down to 15 million.
And so it would take how many million of state money to pull
About 3 million. It's a 4-to-1 match.
We talked in past about using technical college money for state
Yes.
match and using behavioral health for state match.
Yes.
How much dollars specifically have you brought in from those two sources for state match?
We haven't brought any in yet from technical college, although Commissioner Corbin seems very receptive to that. On the DBHDD side, we have about $285,000 this year on the behavioral health side of their state money they transferred, and $518,000 on the DD side that they transferred this year.
I feel like we got a lot of really good information on, as an example, the Kennesaw program that was establishing a college track program for developmentally disabled.
That's correct.
It seems to me that technical colleges, Ms. Corbin, Commissioner Corbin, would be really interested in that partnership. So tell me what the barriers are.
I think it's just a level of education. One of the things I pitched to her was if they could use some of their state money to set aside for a student with a disability that's interested in going to technical colleges. We could match. Now that money would have to actually physically be transferred to our agency, but then we would match that money. Let's say she gave us $500,000 as an example. We would then match that against our federal grant, part of that $15 million.
And they have $300 million budget? I can't remember exactly, but it's...
And the goal then would be we would establish that almost as a scholarship, if you will, for students with disabilities that would go on to technical college.
And is the Kennesaw program and the other college programs for developmentally disabled, are there any partnerships there with VR money?
Actually, one of the things we were able to get this past year is Department of Education actually gave us a grant of $1.3 million for us to fund a teacher position at Kennesaw State. And then Kennesaw State has given us $13,000 of their money, in which we've funded a counselor position who's full-time at Kennesaw State.
So
and we're doing the same with Columbus State and East Central.
You think we ought to follow up with Commissioner Corbin? With
Absolutely. That's my plan. We also met with, just for your information, Representative, we also met with the Georgia Student Finance Commission, because they manage all student, and at the time, I just don't think they understood our program, but we're following up with them as well. And on the DBHDD side, my expectation and my hope is that we could expand that relationship. This was just to get it off the ground, but I think there's more opportunity there. I forgot to mention, while I have the microphone here, we do have a small pilot with juvenile justice in Augusta right now to help move juvenile delinquents who have a disability as part of their transition into the community, hopefully a transition into employment so that they won't have a recidivism rate. And I had a meeting last week with actually the Commissioner of Corrections about doing the same thing with the adult population. I hope that answers your question. Sure.
Chairman Benton.
Thank you, Madam Chair. On 2823-1, funds for merit pay adjustment, is that the 3% that the governor?
It's a 3%.
Okay, so it's not really a merit pay. It's
What they asked us to do is that based on the state's performance evaluation system, the IPP, what we will do is and that's a scale of 1 to 5. So for somebody who gets an overall score of 3, they will get a certain percentage. For somebody who gets an overall score of 4, they will get a certain percentage, and an overall score of 5, they will get a certain percentage. All of those together, we will live within that amount of money.
Okay.
For somebody who gets an overall score of 1 or 2, they will not get any performance increase.
It's kind of misleading then.
Well, I think it is supposed to be based on their performance as measured by their performance evaluation at the end of the year.
Well, I got the impression that it would be a 3% across the board instead of...
No, sir. And we didn't do that last year either.
I didn't know we gave one last year.
We did.
Y'all did. We didn't.
The state agencies were also given a merit-based pay adjustment increase. But it will not be a 3% across the board.
Okay. At Warm Springs, how many patients are there now?
I don't know.
Okay.
I don't actually know.
Since it's taken out of you don't
That's
know
right.
anymore?
That's right.
Can you give me a good guess? Okay, never mind.
Sorry.
And finally, under the total program, how many people are we serving?
I think we're on track this year to serve about 40,000 total in the VR program, and Warm Springs and the Business Enterprise program also serve VR clients. The Disability Adjudication Services serves claimants for Social Security benefits, and then Georgia Industries for the Blind is a production facility, and we have about 120 blind employees that actually produce the contracts.
Okay. The move to pay all that are eligible minimum wage, what's that going to cost?
For the shelter workshops? I have no clue.
No idea. Okay.
But $7.50 is, a lot different than if somebody's making, for example, $1 an hour or $2 an hour. We actually don't support any of the shelter workshops, but our role in this, I think, is to help them transform, to move into more community-based services. But I think it's going to be difficult for them to do because they are supporting a large facility and the cost of that
we're going
facility.
by the federal minimum wage instead of state minimum wage? Is the state minimum wage five something?
I honestly don't know, sir.
Okay. All right, thank you.
I bet we can get some of those statistics, though, figured out. and
I'll
get-
certainly,
get-
thank you.
get
I'll
back to
certainly
us
get
with
that
it.
statistics for you. I'll get the number of patients, we'll get the cost, potential cost, and we'll certainly find out whether it's a state minimum wage or the federal minimum wage.
Right, we'll probably need to work with GRU too, to get actually the number of those.
And we can
warm
ask them
spring
for that. We do have a good
patients. See what we
relationship
can
with them.
Find out and get back to us.
We'll certainly
Be
do that.
great. Are there any other questions from the committee members? Not, okay.
Other than your Board of Regents partners with Kennesaw and UGA, any other Regents universities that have got some VR programs for them?
Any other Board of Regents programs?
Right.
Well, we're hoping to get into Georgia Tech, and we're certainly in East Central, Columbus State, Kennesaw State, and then our goal would be to have a relationship with every technical college in the state, and then to do the same thing with the Board of Regents system. So all the four-year universities, they could do the same thing if they were willing to give us some of their state funding as a set-aside to match against our grant, which we could use to serve and pay for tuition of students with disabilities who go on to a four-year university.
Okay. All right, thank you.
Sure, appreciate the question.
Any others? Well, not seeing any, thank you so much. And
My pleasure. Thank you
for
all.
the increased work you are doing. I
Thank you.
certainly appreciate it, and I think the committee does too. And that concludes our hearing for today. So I thank all of you for your attendance and the work that you do.
Thank you, Jimmy.